If you snore, the real question isn't how loud it is. It's what it's doing to your sleep. Many people assume snoring is just a harmless noise, but it can be a sign your breathing is being stressed at night. And when breathing gets choppy, sleep gets lighter, more fragmented, and less restorative. The tricky part is you might still get enough hours and wake up feeling off anyway. So the goal here is simple. Learn the warning signs that your snoring may be tied to poor sleep quality, so you can take it seriously without panicking. We'll focus on what you can notice in the morning, during the day, and from patterns your bed partner might report. Some signs point to simple congestion or sleep position. Others can hint at sleep-disordered breathing, including obstructive sleep apnea, which is worth discussing with a clinician. By the end, you'll have a clear checklist to work from. Moving to slide 2. First warning sign. Your sleep feels full, but not refreshing. You wake up and it's like your brain never fully powered down. That can happen when snoring is paired with repeated micro-arousals. These are tiny wake-ups you don't remember, but they can pull you out of deeper sleep stages. Deep sleep and REM sleep are where a lot of physical recovery and mental reset happens. If your breathing keeps struggling, your body may choose lighter sleep because it's safer. You might notice you need more time in bed to feel okay, or you wake up earlier than planned and can't get back to sleep. Another clue is waking up multiple times for no clear reason, especially if you fall back asleep quickly. The night can look normal on the surface, but the quality is thin. If this is happening most nights, it's a strong hint that snoring is not just a sound issue. Moving to slide 3. Second sign, morning headaches or a heavy, pressured feeling in your head. Not every headache is sleep-related, but there's a pattern worth noticing. If you wake up with a dull headache that fades within an hour or two, it can be linked to overnight breathing issues. When breathing is restricted, oxygen levels can dip and carbon dioxide can rise. Your blood vessels respond, and that can contribute to that tight morning head feeling. Dehydration can also play a role, especially if you breathe through your mouth all night. Pay attention to frequency. Once in a while is less concerning. Several mornings per week is a different story.
Also notice if the headache comes with dry mouth, sore throat, or feeling like you slept with your jaw open.
Those clues point toward airflow problems while you were asleep. It's not a diagnosis, but it's a signal your body may be working harder than you think at night. Moving to slide 4. Third sign, dry mouth, sore throat, or a scratchy voice in the morning. This often points to mouth breathing. When your nose is blocked or your airway is narrow, your body may switch to breathing through the mouth to keep air moving. The problem is mouth breathing dries out tissues. That can leave your throat irritated, your tongue feeling rough, and your voice sounding raspy. It can also make you feel thirsty right away. Sometimes this is just nasal congestion from allergies, a cold, or dry bedroom air. But if it's a steady pattern and it's paired with snoring, it suggests your airflow is struggling every night.
A simple check is to notice whether you wake up with your lips stuck or you need water immediately.
Also, if you're using lozenges often just to feel normal in the morning, that's a clue. Again, it's not about judging the symptom. It's about connecting it to your breathing during sleep. Moving to slide 5. Fourth sign, your partner reports pauses, choking, or gasping sounds. This is one of the most important red flags. Loud snoring that suddenly stops, followed by a snort or gasp, can happen when the airway briefly collapses and then reopens. You might not remember it at all. Your brain can wake you just enough to tighten the airway muscles and restart breathing. That protects you in the moment, but it can destroy sleep continuity across the night. If someone tells you they're worried because you stopped breathing, take that seriously. It doesn't mean you have a specific condition, but it does mean you should consider a professional evaluation. If you sleep alone, you can sometimes catch this with an audio recording, but even then, recordings have limits. The key is the pattern, repeated pauses and gasps, not one random noise. If this is happening, it's one of the clearest signs that snoring may be tied to sleep-disordered breathing. Moving to slide 6. Fifth sign, nighttime bathroom trips, especially if they're new for you. Many people blame fluids, aging, or a light bladder. But frequent nighttime urination can also show up in people with disrupted breathing during sleep. When breathing is repeatedly interrupted, the body can shift pressure in the chest and trigger hormones that increase urine production. The result is waking up to pee, sometimes multiple times. Of course, there are many possible causes, including urinary issues and certain medical conditions. So don't assume it's snoring. Instead, look at the cluster. If you snore loudly, feel unrefreshed, and also get up to use the bathroom more than you used to, that combination is meaningful. Another clue is that you wake up, go, and fall back asleep quickly, almost like your body was already near awake. If this pattern persists, it's worth bringing up with a clinician because it can be an overlooked sign of fragmented sleep. Moving to slide 7. Sixth sign: excessive daytime sleepiness that doesn't match your schedule. This is more than feeling a little tired. It's the kind of sleepiness where you could doze off during a quiet meeting, while reading, or as a passenger in a car. When snoring disrupts sleep, your brain may not get enough stable deep sleep and REM sleep. You can still function, but your alertness is dulled. Another clue is second wind at night. You drag all day, then feel oddly awake late in the evening, because your body is fighting sleep pressure at the wrong time. Also, watch for reliance on caffeine just to feel normal. Caffeine can mask sleepiness, but it doesn't restore the missing sleep stages. If you notice nodding off easily, or you feel unsafe driving when you're tired, that's a serious signal to get checked. Daytime sleepiness is one of the most practical ways poor sleep quality shows up in real life. Moving to slide 8. Seventh sign: brain fog, memory slips, and trouble focusing. People often call this not feeling sharp. You might reread the same paragraph, lose your train of thought, or struggle with word finding. Sleep fragmentation can do that, because your brain uses deep sleep to consolidate memory and clear metabolic waste products. REM sleep also supports learning and emotional processing. If snoring is constantly nudging you into lighter sleep, cognition can suffer, even if you don't feel sleepy. Another clue is irritability. When sleep is poor, your stress response runs hotter, and small problems feel bigger. You may also notice reduced motivation because everything takes more effort. These symptoms have many causes, including stress and nutrition, so it's not about blaming snoring for everything. But if brain fog tracks with loud snoring and unrefreshing sleep, it's a sign to look at nighttime breathing as a root contributor. Moving to slide 9. Eighth sign: waking up with a racing heart, sweating, or a sense of alarm. This can be unsettling. One explanation is that breathing interruptions can trigger a stress response. Your body releases adrenaline-like signals to reopen the airway and restore airflow. You might wake up suddenly, heart pounding, without knowing why. Night sweats can also happen when the body is repeatedly aroused from sleep. To be clear, these symptoms can have other causes, including anxiety, room temperature, and certain health conditions. But if they show up alongside loud snoring, gasping reports, or heavy daytime fatigue, they deserve attention. Another clue is waking up in a different position than you fell asleep, as if you've been tossing and turning. That can be your body searching for an easier breathing angle. If you're frequently waking in a stressed state, it's a sign your sleep is not calm. Restorative sleep usually feels steady, not like repeated mini-emergencies. Moving to slide 10. Ninth sign: your snoring is position-dependent, and it's worst on your back. This matters because it hints at mechanics. When you lie on your back, gravity can pull the tongue and soft tissues backward, narrowing the airway. The narrower the airway, the faster the air has to move, and that vibration is what creates snoring. If you only snore on your back, the solution may be simpler than if you snore in every position. But it can still disrupt sleep, especially if you roll onto your back repeatedly. Another clue is waking up with your head tilted back or with extra pillows because your body is trying to open the airway. If a partner says, "You stop snoring when you turn," that's useful information. It suggests that posture and airway alignment are part of the story. Position-based snoring can still be associated with breathing events. So the key is how you feel during the day, not just the sound at night. Moving to slide 11. 10th sign, nasal blockage that keeps pushing you into mouth breathing. If your nose is consistently congested, snoring becomes more likely because airflow has to reroute. Common drivers include allergies, chronic rhinitis, sinus issues, and structural factors like a deviated septum. You might notice you can't comfortably breathe through your nose when you lie down, or one side is always blocked. The warning sign here is persistence. A few nights during a cold is normal. Months of nightly congestion is different. Another clue is that snoring improves when you can breathe freely through your nose, like after a hot shower or using a saline rinse. That suggests nasal airflow is a bottleneck. Also pay attention to bedroom air. Very dry air can irritate nasal passages, while dust can aggravate allergies. If nasal issues are driving your snoring, addressing that pathway can improve sleep quality. But if symptoms persist, it's reasonable to ask an ENT specialist about evaluation options. Moving to slide 12. 11th sign, jaw tension, teeth grinding or waking with sore jaw muscles. This surprises people, but it can connect. Some research links sleep-disordered breathing with bruxism, which is nighttime clenching or grinding. One theory is that microarousals trigger jaw muscle activity. Another is that the jaw shifts forward as your body tries to stabilize the airway. You might notice tooth sensitivity, headaches near the temples, or a tight feeling when you first open your mouth in the morning. If you wear a night guard, you may see new wear marks. This doesn't mean snoring causes grinding in every case. Stress can do it too. But when jaw symptoms show up, alongside loud snoring and unrefreshing sleep, it's a useful clue that your sleep is more disrupted than you realize. A dentist can evaluate grinding, and a sleep clinician can evaluate breathing. The key is not treating each symptom in isolation. Moving to slide 13. 12th sign, your blood pressure is trending up, or you've been told you have hypertension, especially if you also snore loudly. This is not about blaming snoring for blood pressure, but studies show a relationship between obstructive sleep apnea and cardiovascular strain. Repeated drops in oxygen and repeated stress surges can affect blood vessels over time. If you're monitoring blood pressure and you notice higher readings alongside poor sleep, that's a reason to think about sleep quality as part of the health picture. Another clue is waking up feeling wired, not rested, or having headaches and daytime fatigue at the same time as higher readings. The important point is that sleep is a body system, not just a feeling. If you have risk factors like a larger neck circumference, weight gain, or a family history of sleep apnea, the case for evaluation gets stronger. A sleep study, at home or in a lab, can clarify what's happening without guesswork. Moving to slide 14. Let's pull this into a practical checklist you can actually use. If your snoring comes with pauses or gasping, that's a top-tier red flag to discuss with a clinician. If you're unrefreshed, sleepy in the day, and waking with dry mouth or headaches, that's a strong cluster suggesting fragmented sleep. If congestion is persistent, consider the nose as a bottleneck and track what improves or worsens it. And if you're seeing jaw tension, nighttime bathroom trips, or stress-style awakenings, don't dismiss them as random. They can be part of the same pattern. Your next step can be simple. Write down 3 things for 2 weeks: snoring reports, morning symptoms, and daytime energy. That record is incredibly helpful in a medical conversation. If you want, share in the comments, do you notice more trouble on your back or in any position, A or B? And if this kind of clear, practical health breakdown helps, subscribe for more. This information is not a substitute for medical advice. The body adapts to what you repeatedly signal.